91.9 Friends of M frequency, friends key, and a very warm welcome to our very special guest today. With us today, we have Dr. Azhar Alam, who is the head of Institute of Colorectal Sciences. A very warm welcome, Doctor, right here on 91.9 Friends of M. Hope you're doing well.
Thank you so much. Good evening. Yes, you're doing well.
So yes, thank you so very much for actually giving us your lovely time and actually enlightening us for the upcoming questions that I'm going to ask today. So the very first question जो मैं आपसे पूछना चाहूंगी कि are piles common and why do they occur?
So actually, let's discuss something. Piles is something which is very common in our population. The problem happens is that it's a social taboo. So there are a lot of people who are suffering, from this disease. There are a lot of data which suggests that roughly 1 in 4 to 5 people have this disease. But the trouble is, people think that this is something which, we cannot talk about. This is something which is supposed to be kept to ourselves. So that is why often people tend to ignore it. But if we talk about how common it is, it's a very common disease.
Okay. Okay. So as you just mentioned, it's a very common disease. How can it be treated, and what are the medicines that is there for piles?
See, firstly, we have to understand that since it's a disease, it needs treatment. There's a misconception that often if we let things to be, they will get cured on its own. But that does not hold true for most of the diseases. And so in piles, we have a set of grading system. The early disease is classified as grade 1. Gradually, as the disease progresses, it gets into grade 2, 3, and so the most severe disease is grade 4. The least severe is grade 1. So what happens is for early diseases, we often advise, there are certain ointments. There are mainly dietary changes, lifestyle changes. We advise people to have a lot of water, fibers. But gradually, as the disease progresses, patients tend to have more complications. They have bleeding, things, masses coming out from the anal canal. So that is when they need active intervention. Now, when we talk of active intervention, for advanced diseases, surgery is the only option.
Well, moving on to our next question right there, that is piles and fistula. Are both of these things same?
No, they are two totally different diseases. But if what happens is in layman terms, in common terms, people often tend to get confused between these two. But these are basically absolutely different disorders of a same spectrum. For example, in piles, mainly the complaint is bleeding. The patient mainly complains with bleeding while passing stools. But fistula is a more complex disorder. In fistula, mostly what happens is there is, pus or blood or some sort of discharge from beside the region of the anal canal. So if you're sitting at home and if you need a rough idea as to decide whether it's piles or fistula, the piles bleeding will happen from the anal canal. In cases of fistula, there's often a swelling beside the anal canal. So not exactly through the anal canal, but it's an opening beside the anal canal from where mostly pus comes out. So that's a fistula.
Okay, okay. As you just rightly mentioned that fistula is a complex disorder. What is the best treatment for that?
See, fistula is a disease on which there's very little consensus all throughout the world because it's a complex disease. So earlier there was open surgery, but what we saw was that open surgery led to a lot of recurrence. That is, even after treatment, patients tend to have the disease again and again. And also with conventional surgery, with open surgery, what used to happen was there was a high percentage of people who used to lose control over their stools, which is known as incontinence. So that is something which is a very discomforting and a very troublesome problem. Of laser today, all types of fistula we are treating with the help of laser, and we are getting tremendous successes at par with the best centers in the world. So today, if someone who knows to do laser properly, laser is the best way to do fistula.
Great. So, doctor, जैसे हम सबको अभी पता है that you are from the Institute of Colorectal Sciences. यहाँ पे what are the spectrum of diseases जो कि treat किया जाता है इस institute में?
हमने जब ये इंस्टीट्यूट ऑफ कोलोरेक्टल साइंसेज जब हमने स्टार्ट किया था, सो हमारा विजन था कि even now there are very few centers जहाँ पे सब colorectal disorders एक ही umbrella में treatment. So, but and colorectal disorders are something which are very very much common in the population. So we started with this mission. Today at the Institute of Colorectal Sciences, we are treating both benign and malignant diseases. That means simple diseases like piles, fistula, fissure, and much more, advanced diseases like cancer of the colon, cancer of the intestine, so basically everything to do with the intestine, everything we are treating at Institute of Colorectal Sciences.
Great, great. Well, moving on to our very next question. That is, why should one actually opt for laser instead of conventional surgery?
I'll put it in a different way. Okay, so 20 years back, or maybe even 100 years back, if we had to travel from Calcutta to Delhi, so what would we have taken? What would have been the transport systems? I'll ask that to you.
Okay, I haven't traveled much, so I can't really
So
say about.
there were carts, there were horse carts. Okay, then with the advancement, buses came in. Now we have amazing flights. In 2 hours from Calcutta, you reach Delhi. So laser is something like that. Laser is something in which patients are discharged on the same day. Previously, in open surgery, there were patients who used to stay bedridden for 2 to 3 months. Today, with laser, next day you're moving around, working around. There's a very rapid recovery. There's minimum pain, minimum bleeding. So if you compare conventional with laser, there's actually no comparison considering the benefits. Maybe 5 years down the line, there will be something new. But today, as of date, there's nothing better than laser for these colorectal conditions.
All right, all right. Well, with that, I would also like to ask you that as you just a while ago mentioned about colon cancer. So, is it curable?
Absolutely. Cancer is something which needs to be taken very seriously. And amongst cancers also, we have cancers which have slightly bad prognosis, which means like the outcomes are not very good. But colon cancer is something, if diagnosed early, if treated properly, it has excellent success rates, excellent survival rates. And the simple reason being, say, when we talk about something like pancreatic cancer, cancer of the pancreas, it is detected very late because the symptoms happen late. In case of colon cancer, unless and until you ignore the symptoms are outright in front of you. Because colon cancer normally presents with, say, bleeding while passing stools, okay, change in the bowel habits, weight loss. So these are some things, which we tend to notice because passing stool is something which we do daily. So, unless and until we absolutely turn a blind eye, there's no way we can ignore it. So the dictum here is if you experience symptoms, contact a specialist because maybe it's not cancer, maybe it's something very simple. But if at all it's something serious, then you can be diagnosed at a proper stage and you can be treated because the treatment is excellent nowadays.
Absolutely, absolutely. Well, last but not the least, जैसे हम लोगों ने mention किया था about fistula and with that piles. क्या होगा अगर इन दोनों को if these two diseases are not treated for a long time or ignored for a long time, क्या हो सकता है?
See, piles basically presents with bleeding. So if you ignore piles for a long time, your bleeding is not going to stop on its own. So gradually you tend to become weak. Okay, you can suffer from anemia. So there can be times when your blood, the hemoglobin level has gone down so much that you might need blood transfusions. Then what can happen is piles are basically masses, so these masses come out through your anal canal and they can absolutely obstruct and block the passage. So in that case it becomes an emergency. Those are called strangulated piles. Okay, so and there's a very small percentage still that's under research, but often piles mimic cancer. So it does not mean that piles is directly leading to cancer, or if someone has piles he'll develop cancer. But often that is cancer, but people tend to presume it's piles. So cancer is mimicked in the form of piles. So that is something which we have to be aware of. And fistula, as I said earlier, it's a very complex disease. The more you ignore, it'll just get more complicated. Today maybe there's one branch, tomorrow there may be five branches. Today there's just pus coming out. Tomorrow there can be stool coming out. So fistula also, even if you ignore, the severity will just keep on increasing and the success rates will keep on coming down.
All right. Well, I'm literally awestruck listening to so many insights today. Well, thank you so very much, Doctor, for being there right here with us and actually
My pleasure.
enlightening us with so many things and sharing significant facts about piles and fistula. Thank you so very much, Doctor, for being there right here with us. Thank
Absolutely
you.
my pleasure. Thank you so much. Bye bye.